The sinuses are air-filled spaces that surround our face, and typically they can become infected, which we call sinusitis. Sometimes these are caused by viruses, but when things don't get better, bacterial infections often settle into the sinuses. These are treated with antibiotics and most patients get better. However, some patients have infections repeatedly, and sometimes patients have infections that frankly just don't get better. In this situation, we call it chronic sinusitis, and this is often caused by the bacteria and viruses and fungi causing chronic inflammation that block the sinuses up where they do not drain properly. Some patients will develop polyps blocking their nose and sinuses. Other patients will get a specific type of inflammation called eosinophilia. These patients with the polyps and eosinophilia are often a little harder to treat and more often end up with surgery. Typically when patients have sinusitis, we start with medicines, antibiotics, nasal steroids, cortisone sprays, and sinus rinses. At times, steroids through the body are used to try and keep people better. When this does not improve, surgery is often performed. Surgery is typically done through the nose with telescopes on cameras. We typically use mini shavers to open up the sinuses. Balloons are often used while we're in there to help dilate the sinus tracts in a more non-invasive way. Typically, packs and splints are not placed in the nose when I do nasal and sinus surgery, making the recovery more comfortable. At times during surgery, your CAT scan is often loaded into a computer that we use to help us with navigation to know where our tools are to make the surgery safer. At times with nasal surgery, the nasal septum can be bent, and at times surgically the septum is straightened. This is surgery for a deviated septum, and these are performed when patients have trouble breathing out of one side of the nose, or they may happen to have pain if they have a sharp bone spur, and when the nose congests, it can dig into that spur. Many of these are done endoscopically or minimally invasive, but those patients with more severely deviated septums will have more an open approach through a small incision in the nose. Again, these patients generally don't have packs and splints placed, making the recovery more comfortable. Some of the new developments in sinus surgery involve using balloons to treat the sinuses. For years, we've been using it to dilate some of the harder to get to sinuses, but now we're starting to do that in the office for people with milder disease. These patients may have small amounts of thickening of the lining on their sinuses. They may have pressure flying in an airplane. They may have problems with repeat sinusitis. Some patients experience sleep disruption at night. That sinus will clog, giving them discomfort and may wake them up. We've been having good success using the balloons in the office in adults to treat these patients. Balloons are also being used in the pediatric patients when they have chronic sinusitis, and in those patients it's common to perform an adenoidectomy and at the same time use the balloon to dilate their cheek or maxillary sinus. When this combination procedure is done, a significantly higher success rate is achieved in controlling the children's chronic sinusitis.